So this is a video on doing lymphatic massage to help open up your detox and drainage pathways manually for yourself. So there are 6 lymph node stations throughout the body that if you massage them in a certain order, that can help open your lymphatic flow. So let's get started. So we're going to start with the collarbone, that's number 1. And for the massage, you're going to just slowly pull down right at your collarbone on both sides. And you want to do this about 10 times. So not super hard, just pull, press and pull. And at the end of the 10, you're going to stop and hold it for just a moment as you breathe and then release. Number 2 is behind the ear. So you actually want to follow your jawbone up to the ear and then go down to that space behind the ear where your jaw kind of meets your neck right there and inside that little space. And you're going to massage down again. So you're going to press in and pull down, in and pull down. And this is going to help, this helps bring fluid from the head and the neck down into the lymphatic drainage. So it can help with sinus issues, it can help with headaches, it can help with earaches as well. And again, you massage about 10 times, and then when you're done with the 10th one, you're going to hold it for just a moment and take a breath. Now the next station is the axillary, which is under the arm. You can do both arms at the same time, but I find that a little awkward, so I'm going to do one at a time. You want to bring your hand up under your armpit. You're going to reach up and forward, so you're trying to bring the lymph towards the body. And this is going to help bring lymph from the arm and some of the upper chest into the lymph drainage pathways. So just up and in towards the body. So around 10 times you want to massage. And then you're going to stop and hold for a moment. And then you want to do the other side. So same thing. So again, this is bringing fluid up from the arm and into the torso where the 2 main lymph ducts are located. One is right under the collarbone that we just did, and one is going to be the next one that we do, which is the thoracic duct. So the thoracic duct, or the sternochyli as it is often called as well, you want to go from your belly button, above your belly button, but below your rib cage. So find your rib cage, and you want to go right in the middle. You're going to push in and up this time. So you're going to massage up, not down, because we're moving fluid up into this sternochyli or thoracic duct. Now, it's actually better to do this on skin and not through clothing, but I'm not going to show you my skin. So this can be very helpful to do in the morning before you get dressed when you don't have clothes on. And the 10th one you're going to hold. Now we're going to go into the groin area. So we went from where the arm meets the torso. Now we're going where the leg meets the torso. And so you want to get right in where your leg meets your torso, right? This one you can do both at the same time because you're not really crossing over your body. And again, you're going to push in and up. So this is going to help move lymph flow and fluid flow from the lower legs and the thighs and the pelvic area and the urinary tract area up into the lymphatic flow. So you're going to get right into that groin area, right into that spot where your thigh meets your torso. And again, on about the 10th one, around 10, you're going to stop and hold. And then the 6th station is behind the knee. It's called the popliteal. And again, you can do both knees at the same time. You're going to massage up and forward towards your thigh because, again, we're bringing the fluid up towards the torso. So you're just going to massage up and forward. This is going to bring fluid from the lower limb up towards the thigh, which is then going to move it up into the torso. So if you have swollen ankles or swollen feet, some edema down there, this can help to move some of that fluid flow. It can help with fluid on the knees. It can help with, overall circulation in the legs. and then you're gonna hold. Now, to make sure this fluid continues to get up to the torso, I often go back to the groin area, but I go a little bit higher up. So last time we were down here, I'm gonna go higher up closer to the hip this time and do it a little bit lymph flow there. So this isn't really the 7th station because it's part of station number 5, but I'm just gonna go back to 5 and move up a little bit higher to get some lymph flow there. Sometimes I leave my legs open. It gives me a little bit more space to do the massage. And hold. And then one last time, I'm gonna go back to that thoracic, right above the belly button, below the rib cage, and push up and do one more massage there, because this is the main duct for the whole body, and we wanna make sure that this is the duct that's moving the most. And then around that 10th one, you're gonna stop and hold and release. Now, you may even feel some tingling in your body after you do that because you've got some lymph flow moving, which is great. So again, we're gonna do 1, 2, 3, 4, 5, 6, go back to 5, go back to 4, and then you're done.